If you call for help for someone suffering with a mental health crisis, it is more than likely a police officer will show up instead of a mental health worker. In Toronto, police receive 30,000 calls every year, 30,000 related to mental health. And that demand is too high for the team trained to handle all of those calls. So with a growing movement to direct police funds into crisis intervention teams, social worker Keith Adamson is joining us with more on what that could look like. Good morning to you.
Good morning, Anne-Marie. Thanks for having me.
I'm glad to have you here for this conversation. Since April, at least 5 people have died during mental health calls, 5 people dying after calling for help during a wellness check by police in Canada. All 5 were either Black, Indigenous, or people of color. In your opinion, what needs to change?
Well, thank you for having this conversation today, because we need as a society to learn how to deal with mental health issues beyond criminalizing and shooting people. And I think this collective conversation about mental health and the police services are really important. I think what has to change is we have to look at rethinking and remodeling policing.
Right now, for people who don't know, right now, when you have somebody in mental distress, you have to call 911, and then the dispatcher decides whether or not to send police or whether to send an ambulance, because the options available are a police call or a trip to the ER. Are there any other options available right now for people?
Well, if you're looking at options that exclude calling the police, the first option would be to see if there's anyone in the person's immediate environment, like a community member or a trusted friend who has a really strong relationship with the person in crisis, who understands their circumstances, who can help the person to de-escalate and potentially take the person to, an emergency department. The second option is to connect people with the appropriate crisis lines. There are crisis lines working 24 hours, 7 days a week, like the Toronto Distress Center. And the third option is connected to, the second, in the sense that crisis lines provide, some crisis lines provide a mobile crisis unit staffed with mental health professionals who come out to see the person in distress. So services like the Gernstein Center Crisis Line offers people experiencing mental health issue or substance use-related crisis with a mobile crisis intervention service.
I want to tell people about a team in Toronto. So the mobile crisis intervention team you mentioned is comprised of a mental health nurse and a specially trained police officer. However, they only respond to calls if there are no reports of a weapon, and citizens cannot call them directly because the demand is too high. So how would the mental health community feel about taking on more of those calls where there is aggression or there is someone who is weaponized?
Listen, I think we're in the midst of trying to reimagine what the service could look like. Mm-hmm. So if we can reimagine a system so that this can be done safely, I am sure that there will be many mental health workers who would be interested in collaborating and moving this forward. The mental health community, including social workers, are happy to take these calls. And, you want to ensure as well that the right people with the right skills at the right time answer those calls. And social workers deal every day with people in crisis, in the homeless shelters, group homes, hospitals. And when you look at the statistics and you see that most Canadians killed in police encounters over the last 15 to 20 years have had a mental health issue or a substance abuse issue, you realize that, the mental health community cannot just stand by and do nothing.
Keith, I want to thank you. It's good to have your perspective as a social worker, and we have lots to talk about on this topic. We will have you back again for sure. Thanks so much for being with us this morning.
Thank you very much, Anne-Marie.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.